Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. Today, I want to talk about traveling, and that impacts two worlds that I'm involved in, of course, with cancer and cardiac. Now, there's no perfect timing when you get struck with a health crisis. So you either have plans made already, or you're at the end of that crisis and you can't wait to get back to normal and do the fun things that you're used to doing. Now, the first thing that I'm always going to recommend, and again, for some it seems like a waste of money, buy insurance. That way you're covered if something were to come up and you weren't able to make your trip or whatever. Um, Generally, it's not expensive, but it will get you your money back most likely when the conditions are written into your agreements of purchase. So, now for the buzzkill part. Okay, in order to, the question that came across my feed was, um, will I be able to travel during my treatment periods or in between my treatment periods? Or how soon can I fly after my heart surgery? Or how soon can I go on a cruise and things like that? Bottom line, you have to assess the risks. Now, again, I know a lot of money gets put out when you do your traveling and you hate to lose it, but there are things way worse that can happen if you expose yourself before you're ready. For instance, going through chemotherapy, okay? You want to go on a cruise, which of course, we mock cruises as being floating petri dishes. But then again, that's where a lot of viruses get spread. And if you come back off a cruise and you come back with something that another passenger had, that can delay your treatments. And that's not good. Okay? It's devastating to be told you have to delay your treatment by a certain amount of time to allow your body to recover. By the same token, same with a cardiac patient. Okay? The last thing you need is any kind of infection from somebody who's already sick, passing it on to you, and having that infection get into your heart. Okay? Well, I just did a video on Kyle Busch. Okay? You don't need any kind of sickness compromising what you're already dealing with. Okay? And that's the long short of it. Now, of course, another thing to consider, and especially when it comes to the cardiac situation, how soon can I fly? Again, these questions are better left up to your doctors, which I'm not a doctor. I'm just telling you the experiences that I went through. Um, my first heart surgery, which was an open heart surgery, um, I flew about 4 months later. I did go through my doctor to ask if there were any kind of concerns. Since then, I've had various what they call transcath surgeries, where they go up through the leg. Had two other heart surgeries and had a carotid artery surgery done. And I flew within a week, and my doctors were aware of that I had to fly, mainly because that's where I was having my surgeries done. So they knew those risks. Okay, big risk, of course, is having blood clots develop. Okay, there are constant stories about passengers. It doesn't matter how long your flight is. You get up that far in the sky, and you throw blood clots. That can be the end of you. Okay, so that's something to consider, especially if you're dealing with a recent surgery. But the final thing in dealing with traveling while you're going through treatment, while you're recovering from your heart surgeries and things like that. And trust me, I see a lot of my fellow survivors who travel out of the country, even. The thing you have to keep in mind, no matter where you travel, if you're flying from one state to another, flying to a different country, whatever, you are flying away from the care that you're getting. You are flying away from the medical professionals that you deal with, that understand your health condition and understand that you may not have that same level, that same skill wherever you're going. On a cruise ship, okay, you're out in the middle of nowhere and something happens with your heart that you just had operated on. You're up a creek because there's nothing that can be done for you out there. Okay, that's why, really wait until you are fully recovered to do the things that you want to do. I get it. You want to go back to normal. Okay, I understand it. 37 years as a long term cancer survivor, 18 years as a cardiac survivor. I remember what it was like to not be able to do things and how inconvenient it was, and how I didn't want to see my life interrupted. And all I wanted to do was get back to normal. But it would be far devastating to have a setback, delay your cancer treatments, to have something go wrong with your heart, and have to rely on somebody who may not have the knowledge to take care of you. There are a lot worse options than just postponing your trip or, if need be, canceling. There's nothing wrong with having to wait a little bit longer. And, I get it. I don't want this cancer stopping me. I don't want my heart preventing me from doing what I want to do. Okay, there are rewards, and there are consequences. The key is not to have the consequences. So if you're not sure if you should be taking a trip or not, ask your doctor. They'll tell you, and make sure you tell them what kind of trip you're taking so they know the risks that you're exposing yourself to, and let them make their honest opinion to you. I can tell you, I've made plenty of trips over these 37 years. Okay, I made 2 trips to China to adopt my daughters. Okay, I've made other trips elsewhere in the country here. Okay, I've gone to concerts, I've gone to movies, I've done everything that I can possibly want to do. And yes, I've done cruises as well. That was a long time ago, but I've done them. But things are different, and you really have to weigh the risks before you decide to go through with it. Not saying don't do it. Just make sure you assess everything and make sure the timing is right. And that'll be worth it. Until next time, this is Paul's Heart.